How's it going? Welcome back to another episode of the Digital Health Podcast. If this is your first episode, we have a great one for you guys. For folks who don't know me, my name is Anthony Virgo. I spent the last 7 years at a health tech startup. I do my own AI automation business with my co-host and partner, Kazar. I'm going to pass it over to Kazar to introduce himself, but we also have Frank on the line with us, who's we're going to have a great conversation with.
Hello everyone, my name is Fazal Shahid and I have been working in the healthcare domain for quite a while. I started with the dental practices, but when we collaborated together, now we are working with a lot of healthcare professionals. We are working with dental practices, psychotherapists, psychologists, physiotherapists, and uh, we just have started the digital health podcast. So this is the brief introduction about me. Now I want to kick it over to our guest Frank.
Hey everybody, my name is Frank Russo. I'm a licensed clinical social worker and licensed certified alcohol drug counselor in New Jersey. I own my own private practice, Russo Health and Wellness, and I also work in behavioral health hospital.
Got it. Thank you so much for your time, first and foremost, for being on the Digital Health Podcast. So we always like to open up about understanding people's journey into healthcare. A lot of people that we talk to, especially for myself, it's the same for myself. We kind of came into the healthcare industry by accident. I tell people that I was in sales and marketing before. I actually was a car salesman before I got into healthcare. And then I kind of fell in love with healthcare as I grown within the industry. So my question to you was, how did you start your journey in the healthcare industry? Either working with substance abuse or even, on your journey with your private practice. How did this journey start for you? And how did you get the spark to actually be in healthcare and make an impact like you're doing now?
Gotcha. I like how you reference it by falling into the business by accident, because I had no like means or any idea of getting into healthcare when I was younger. My family was in the restaurant business, and we had restaurants, and that's what I thought I was going to do for the rest of my life. I'm a person in long-term recovery, right? So I had my own battle with mental health, with substance use, that kind of landed me into this business. So I went through my own journey. I went through my own struggles, and I decided, you know what? I wanted to do something impactful. I wanted to help people. I wanted to connect with individuals, and I knew what it was like for me. So I wanted to give back in a different way. So that's kind of how I got into the field.
Got it. So you pretty much use yourself as an example to now serve the people that you're serving, almost.
Absolutely, yeah.
If that makes sense. Okay.
Absolutely.
And I find that as a theme too, like for people who might have accidentally fell into healthcare, there was always a reason that kind of stirred them there in some way, shape, or form. It's interesting that you thought you were going into the restaurant, doing that's like almost like, food, hospitality, kind of a whole different lane of things. Still in some way, shape, or form serving people with their health if you're talking about food, but in a different way. In a different way.
Yeah, and one thing I think that's beneficial about the experience of working in a restaurant and understanding all that is the communication aspect of being around people, learning how to talk to different people, standing in front of a bunch of people at a bar and learning how to entertain for a little while. So the skills learned in there did translate into what I do now.
Got it. And that's important, because as we're talking about healthcare, there's been like a lot of changes, obviously, like technology, AI being one of them, right? How do you, I guess, with AI being a thing, whether it's in healthcare or just a thing that you're doing with ChatGPT, how do you still maintain like that personable touch? Like you said, working with a restaurant, that's key to know. Like AI isn't going to be able to greet somebody on a first name basis, almost like, hey, I know John because he's been coming to the restaurant with his family, with his daughter and stuff like that. How do you think, or what do you think is the best way to kind of keep that personable touch in business now while you're running your own practice?
Well, I mean, I think AI technology is super helpful and it could be definitely a positive benefit tool, if you use it correctly. But I don't think anything can take away from the one-on-one connection that a human being can have with another human being. When you're in the room with somebody and you feel their energy, it's a different experience. And I don't think AI can replicate that. However, AI can do many different things that's helpful for me as well. Like I'm working on paneling with different insurance companies right now. And go into AI and say, hey, how do I panel with Horizon Blue Cross Blue Shield? How do I work with Aetna? And it gives you step by step how to do the whole process and helpful, or how do I best help somebody with A, B, C, D, right? Like whatever they may be struggling with, and it can give you some tools, but then you have to make it your own in your actual work.
1000%. So just using it more so as like a leverage tool to optimize what you do on the human level, or by keeping the personal touch that way.
Absolutely.
It's interesting because a lot of people that we've talked to on the episode so far, they're either on one or two sides. They're on the side where they're like forward thinking, like, AI is a tool, like we're saying now. It's just a tool to optimize what we're doing now, and it's here to help us in many ways that we could do it. And then there's people that's like, no, like I'm not for AI. This thing can't replace us and will not replace us, and I'm not allowing it to replace us. That's kind of where and it's rare where we find someone in the middle that's like against it and then also for it, but it's usually split in between the middle. Like, hey, we're forward thinking. I think it's a great tool. We just need to harness it. And then there's people like, absolutely not. I'm shut off for it. It sounds like you're either actively already using AI, maybe in your practice or your day to day. Explain a little bit about how you might interact with AI, and how would you suggest maybe some providers or even people on the clinical side, whether they're interacting with someone who might have like substance abuse issues, leverage AI. What are some ways that you're using it currently?
So I think one of the biggest benefits and what's most helpful for me is in the aspect of like notation. Documentation in my field as a psychotherapist is one of the things that we dread, right? Like the conversation with the other person in the room is it comes naturally. But then after that session, what people don't see, even if you're a medical professional or a doctor, you still have to document. And that takes up a lot of time behind the scenes, especially if you're back to back to back with different patients. So I think AI, in a sense, can come in and really help with the documentation. And it's not perfect, but I think that it gives us it's an advantage that we could utilize. And if we can optimize our business, why not? I'm not against AI. I don't think that it could take away from what we do. I think it can be helpful, it can be a benefit, but nothing can compare to the connection that a human being can bring.
1000%. And I hear you on that front. I guess you have you interact with certain individuals, like say for example where you're getting notes transcribed, or you're using AI to do something that's kind of speeding up the process. Has there ever been a scenario where you introduced it to someone and like, hey, this is how I'm doing it, and they're like completely turned off on it? Or is there scenarios where you're working with people where you're actually using an AI tool that's speeding up the process, and they're like so reluctant, like, I don't even want to trust it for the notes?
Yeah, I think many people that are afraid or fearful to use AI don't understand it and are scared of it. So I think that when it's better explained or you show somebody how it's utilized, because it's not taking away from what I do, it's me providing, like even in the documentation process, I have to provide a summary of the documentation of the notes and how the person was in the session. But AI helps break it down to a clinical, more concrete way where it's also beneficial if you're in network with insurance companies for that insurance reimbursement. I think other people are just afraid because they're just not used to it and they're stuck in their own way.
And Frank, you just mentioned that you are using the AI for the documentation in your daily work. So, do you also think that AI can also be used to improve the patient experience in the healthcare, or have you ever tried this in your private practice or something like this?
Yeah, I mean, I haven't utilized AI while in session with another patient. but I think it can 100% be utilized if done correctly and if the programs were, set correctly. Like you could use it for exposure therapy. Let's say for someone that was afraid to get on an airplane or someone that was afraid of heights, and in a session actually expose somebody using an AI program and help at the same time. I think it could be super beneficial.
Yeah, I think even encouraging people to use it outside of work first before they even decide to use it in the work atmosphere. Because I think even you're right, there's a lot of people that's kind of just afraid of it or just turned off on it of it, and they don't even know why because they're not even using it, or they're using it in at their workplace, or they're being told to use it at their workplace when they've never used it outside of it and don't even know like how it could benefit their day to day or their workflow, right? A lot of what we build at, A Plus Active Services is we do voice AI. So think of like voice assistants, whether it's a website widget or on a phone call, where, maybe the front end staff might be overwhelmed, or it just might be after hours and they don't have no one to kind of pick up the phone. We would then equip the agent to kind of handle all of that, do intake, do insurance verification, reschedule, right? If somebody called after hours and wanted to reschedule their appointment, who's not tech savvy, that's not online, they can actually still call the clinic and still get service. It's all AI, but it's still able to answer the question and triage to the providers, book the appointments, put it on their calendar, all automative. And then even a lot of times you can't even, I'm not going to say you can't tell that the person, the agent isn't a real person, but the way the technology is getting so good that sometimes you can't even tell that you're talking to a AI agent versus a real person, right? I work with like a lot of providers from anywhere between Harlem and then Brooklyn. As you know, Frank, being in Jersey, the landscape and the demographic of people change, right? Just one block
Oh
in a
yeah,
1 block radius, So
yeah. You go from
even
super poor to super wealthy just like that.
right. But even if I'm building an agent in Harlem, I'm then looking at the zip code, understanding, okay, Spanish might be the top speaker, speaking
Mhm.
language
Sure.
in that area. So now I need to build an agent that speaks Spanish or is bilingual. Where in healthcare, sometimes the language barrier stops people from actually getting the help that they need. Not saying AI could fix that, but that's just one barrier that we
I
were
think you bring
over
up
to
I
kind
think
of
you bring up a
overcome.
really good point because it is a big barrier, and right now the technology utilized for the most part with even just different languages in the Bergen County, the county I was born and raised in, and where I still work. There's over 260 languages spoken in that county, right? So it's very diverse. We're 15, 20 minutes outside of New York City. Um, you have to actually, for like a translation line, you have to get in, there's an iPad machine, and then you have to get someone to answer it, and then hopefully they speak that language. With this kind of technology, you can have a conversation with the person right in front of you using something that can translate, and that's a benefit because there's so many people that have barriers and don't have that access to really good healthcare, whether it's psychotherapy, because of that translation piece, right?
Right, 1000%. Trust me, I was one of those people in my earlier days in healthcare on the transit. I would have to call a translation line and then wait for
Oh yeah.
someone. And it's like there's so many steps where you can actually build an agent to kind of even respond and speak the same language so they can actually get the questions done and then even get it transcribed so the provider knows what happened when they were either gone or needed support in some way, shape, or form. So we've seen it support so many in so many different ways on so many different angles just on language itself. Um, what about some of your patients have some of your I know you said you haven't used it in on a session, but are you getting being that healthcare is changing so fast, meaning in our industry, we're seeing a bunch of technology come down the pipeline. It might not be client facing, the clients might not know about it, but on the back end, right, there's a bunch of AI tools that have been incorporated, whether it's transcribing notes, whether it's AI agents like we talked about. Have you seen that patients are starting to interact with AI in some way, shape, or form, or have you heard about that, especially in your field? Is that becoming a norm almost?
Yeah, I think many patients. I think most part, depending upon the population you work with. I usually work with young adults and individuals up until their 50s. So most of my patients are utilizing AI not only in their own professional experience, but in everything. We could talk about something in a session, and they look up their mental health diagnosis, and they're looking up symptoms, and they're like, "Oh, this is me. This is not me." It could be helpful. It could be harmful. It all depends. But I think it's as an educational tool, it could be great. It can be wonderful, and it could be something that can be brought into session where we can explore even further. So yeah, I think the patients are using AI.
Got it.
I don't,
So
I
tell
don't, in my perspective, I don't look at it as something bad. I look at it as we need to learn how to utilize it correctly.
1000%. So tell me a little bit about the health and wellness practice that you started. What is, I guess, pretty much the mission and the goal? Who's your ideal client, and how are you making sure that the people that you interact with get the best care in this landscape now?
Yeah, so I started my practice in September of 2025, so it's fairly new, right? I've been in the field for about a decade, and I've worked with individuals with substance use disorder to anxiety, depression, bipolar, schizophrenia, all over the place, right? But I wanted to focus in on young men, and with substance use disorder, anxiety, depression, and really focus in on the vulnerability factor, meaning like I don't know about you or how you guys grew up, but if men didn't talk about the way they felt. They didn't share that. If men cried, they were weak. So that all that stuff, I want to kind of change the belief system on all that. I want to provide a community and a network of support that men have for each other to uplift each other, to speak openly about things. It doesn't necessarily even have to be anything bad. It could be about how to be a parent. What is it like with the struggles of your relationship now with having a young kid? What does it look like working, in where I live in New Jersey? It's hard. It's the hustle and bustle. You're working, to provide. The cost of living is very expensive. What are the pressures like around that? So I'm trying to create an atmosphere surrounding that. But ultimately, what I truly like to do, I started off telehealth. But the goal is I live up in the country right now. And I say the country, it's northern New Jersey, right? A lot of farmland. But the goal would be to get like a trauma center, almost like a therapy farm, barn, emotional regulation, saunas, cold plunge, gardens, pets, and really do therapy surrounding that type of, that aspect.
I love it. I love it. I'm gonna be honest with you. That sounds. I would love to have a provider, or have a if I'm going to get some type of care, to cold plunge after, or to be in a sauna
Mhm.
immediately after. That's an amazing idea for sure.
Yeah, because typical therapy, you're sitting in a room with another person, and it's all the same. Somebody's on a couch, somebody's on a chair, or you're across from on a screen, which is helpful, and it could be a hybrid thing. But I think we need to expand the way we look at therapy and the connection and what actually makes people change. You know?
Right, 1000%. We've even talked to a lot of people who do play therapy, which
Oh
is
yeah,
like very popular as well, and
sure.
is an interesting concept that a lot of people benefit well from. What would you say is, from your experience with substance abuse disorder, or just patients that you might have interact with? What is like one misconception that the average person might not uh, know? And I'll give you an example. We were talking to maybe a psychiatrist, and he during the episode we were having a conversation, and we had a epiphany moment, or I had a realization where he let me know that just because somebody like someone does not just because someone has trauma doesn't mean they automatically have some type of mental issue or mental problem, and vice versa. Just because they have some mental issue or behavioral problem doesn't mean that they went through any trauma at all. And that was a big misconception. So what about you? What are some like misconceptions within your day to day, or within the clients that you kind of work with, that the average person might not know, especially especially with like the men that you might work with in substance abuse?
So I think one of the biggest misconceptions is that substance use in itself is the problem. The substance use in itself is the solution for the problem that they're actually dealing with. People are dealing with trauma. People are dealing with grief. People are dealing with past abuse in many different ways. And the substance use is how they actually cope with the problem. And most people come in like they just won't stop using, they won't stop drinking, and we focus so heavy on that. But there's so many underlying issues to why somebody behaves in the way they do. So I think that's probably one of the biggest misconceptions, or that especially in the area that I live in, if you think of somebody who would be a quote unquote addict or alcoholic, we have that picture, whatever the picture that comes to your mind might be the person on the side of the street with a bottle in the bag or a needle in their arm, when it's really not. It could be the lawyer that's representing you in court. It could be the police officer that's protecting you. It could be the judge. It could be the doctor that is treating your children. So it's like there's many different misconceptions of what we view substance use as.
Right,
And
a thousand percent.
Frank, what do you think is giving the online therapy session equally uh, that much, than giving the in-person session, therapy session? Like,
I just want to make sure I understand the question. Are you asking me if is it equal, like an in-person session?
I'm asking that what do you think is giving the online consultation or therapy session equally effective for the patient than giving the in-person therapy session? Like, is patient equally expressive in the online session as well, like he or she is in the in-person session?
Yeah, I would say it's subjective, right? I would say that it depends on the person and also depends on the therapist. I'm really animated or entertaining, I should say, especially in a session with somebody, and I get to a point where I try to break the barrier of I don't want to be how do I best say this? I don't want to present that I'm not authentic. I want to be me in all aspects of life. I'm not talking in therapist voice. I'm not pretending to be somebody who I'm not. So I think for somebody like myself, it's easy to create that therapeutic alliance, that rapport with the patient. Where for other people it may not be, but for me, I find it easy in both aspects. I think I can get the person that on the other end of the screen to relate, to talk, to share, to be animated, and that's the creative art that we do, and I think that it's an art therapy.
And on the basis of experience, tell me one thing, that are men equally expressive, just like women, or who is more expressive among men and women, as per your experience?
From my experience, I'd say women are way more expressive, way more
Okay,
open
and
to talking about certain things and getting sensitive and vulnerable to cry. In a session, it's more likely that a female patient will cry as opposed to a male.
if you have some patient who is not that much expressive, but he or she wants to come out of his trauma, so what is your approach to tackle that patient or that client?
So everything in therapy comes down to the relationship that you establish with that patient. So it doesn't matter the type of therapy you're utilizing. If someone doesn't feel safe or trust you as another person, they're not going to heal. They're not going to get better. So for me, the therapeutic relationship is the most important factor in change. So building that trust, creating safety, making sure that person is regulated, not in fight or flight, is able to feel comfortable enough to start to unpeel the different layers. That's the most important thing.
Sounds good. Sounds good. Sounds good. Perfect.
And and how would you like say if I was a young guy who wasn't as expressive, but I'm open to therapy. I might need help. I might be dealing with some type of substance abuse disorder, and I come to your private practice. What I guess what would you say to someone who is not necessarily so opened up, or what would you do to kind of get them to open up? I think that relationship aspect, like you said earlier, is important with the patient in some way, shape, or form. But what are some things that you are trying to let them know or trying to let them realize when they come into your care? What are some helpful things that make them actually drop their guard and start to open up, in your opinion?
Yeah, sure. So I think one of the biggest, and this is a tricky thing for other therapists, they may not agree with me, but I'm going to say it anyway. I think self-disclosure is probably one of the most important tools, when used correctly, me sharing my own experiences. Sometimes, we go for help and we think the person on the other side of the screen or the other side of the room has everything together, has their whole entire life together and doesn't have any struggles. So I think when you get vulnerable on another level with another human being and let them know that, hey, I have my own struggles too. This is what I've been through. This is what I still go through. This is how I deal with it today. But look where I'm at, and you can be there too. And also inviting them into community, because community is where we see real change. When people don't feel alone, when they have other people that are very similar to the experiences they went through, and see how well they're doing today, that it's actually hope, right? That they can also get better too. I like to use the acronym of like hope as hearing other people's experiences. So I try to connect other men with other men that have similar, experiences.
That's amazing. That's amazing. Oh man, this has been like a wonderful episode. So I want to wrap up with two questions. One,
Sure.
the first one is going to be, what's the best way for people to kind of connect with you and contact with you, whether it's maybe the listeners might have heard something that they want to ask a question about, or actually visit you at your private practice in some way, shape, or form. What's the best channels to connect with you? And then my last question would be, what's one powerful message you would leave with someone who might have been listening in on this episode? And it could range from anything from, the AI stuff that we talked about, or just the openness and willingness to seek some type of support in any health domain. You know what I mean? It could be as broad as that. So, what's the best channels to connect with you, and what's a powerful message you want to leave us with?
So, I think the best way to contact me is probably either via email or social media. I have Russo Health NJ on Instagram. I also have my LinkedIn page. You can just look my name up, Frank Russo, on LinkedIn, and send me a message, and we can connect via through there. I think that's the easiest and best way. And one powerful message, I don't know, it's on the spot, but I think I would say, be yourself. Everybody else is taken. I would say to allow people to know that it's okay to be you, and it's okay to be unique and different, and you don't have to be what everybody wants you to be, or what you think everybody wants you to be. So that's what I would leave with everyone. Learn how to be yourself, learn how to be comfortable, learn how to surround yourself with the people that love you and care about you and protect you in the room even when you're not in there.
Love that. Love that. Oh man, that's powerful. And I think, yeah, it is on the spot. The question is on the spot because I feel like, it's powerful because health is so broad, right?
Sure.
Health could you could be impacted by your community, or the community could be a service to you or a disservice. There's so many different ways, even digital. We know that AI is also, I mean, if you want to backtrack and think about when social media became super popular, we now know the effects of what social media can do on someone's mental on a day-to-day,
Oh yeah.
especially if you're waking up and looking on the shade room or whatever you're seeing on Instagram, but seeing something negative every day, subconsciously it might impact you. And we know that AI in some way, shape, or form is going to impact people in the future. We just don't know how yet. We're already seeing extreme cases where people are having relationships with AI and things like
Mm-hmm.
that. But we know that health is so complicated and so broad that there's no one size fits all. So a powerful message about just being you and being yourself, and bringing your whole self to the table and being unapologetically that is a form of righteousness, or a form of like top tier health that I think a lot of people want to strive from. Like, I want to stop thinking about, what people think, or, things of that nature. So love
Yeah.
that 100%.
And when you're truly who you are, and you're truly genuine and authentic, you're gonna attract the people that are like that into your life. The people who you're always looking to get into your life but don't know how to get them in. It's by being yourself.
All right. 1,000%. Well, Frank, thank you so much for joining another episode of the Digital Health Podcast. This has been amazing. So many gems, so many great value has been in this conversation, and we can't wait to have a part two with you 100%.
Thank you very much.
All right. Cool. So we're going to end the recording now. Go ahead.